SmashweRx over here across the Brentwood. We got Rob. Say hi, Rob.
How's it going?
Rob's gonna be my my test subject today. I want to check. You gotta check this out. We're gonna go over some shoulder mobility. But here's what's really cool. I didn't know. Rob's got a little bit of an issue with his left shoulder from a lot of baseball. You lefty?
No,
Sure,
right.
Catching.
Overcompensation for right hand, so not using my left.
So Savage CrossFitter, these guys just rode like a 10K and did this run and just nothing but cardio. It was just abysmal. So stuff I'm not gonna do. We're gonna go over his shoulder. We're gonna fix it right now. But I had a guy on Instagram send me a message about how he's having problems with. We're gonna turn Rob around just a little bit. Posterior inferior portion of the joint capsule on the shoulder. So what happens is we get a couple of things that happen. We're gonna face this one. With the shoulder, we get a lot of what's called external rotation issues because we do this all the time. So he knows anatomy pretty well. We got the lat and the teres in the back. They externally rotate, but they also do a pull. So when they get really short and tight, the subscapularis in here too, when they get all really short and tight, what happens is they tend to get our shoulders to do this. So when we do things like muscle ups, we catch really far forward. When we do a row, we sit really far forward, right? So he's like, yeah, we sit forward in our row. The only reason I know this is because I watched him row. We sit forward in our row, that's gonna cause a lot of that shoulder to sit forward. Well, the back portion of the joint is gonna get all thick and immobile, so we're gonna loosen it all up. Right now there's a dog getting soaking wet out behind you, so in case you get splashed, it's not my fault. Just let me know, Chris, okay? So we're gonna go through some mobility. So the first thing we're gonna do is we're gonna loosen up just the teres and the lat. He already knows what he's doing, so we went over this before. This is gonna restore what's called that posterior inferior roll slide glide. So for the guy on Instagram that asked me to help you, this is what you're gonna do, all the things I'm gonna go through. So this is really cool. He's turning his head because there's something called the thoracodorsal fascia and cervical dorsal fascia. Now this fascia is like this paper that is between the muscles that allows the muscles to slide. So he's putting a lot of tension on it. When he turns his head, it puts even more tension on it. But this is releasing, he can feel it all through here, I guarantee it, right? So the teres comes here and the lat comes here. I'm gonna help him out. This is where being an awesome Smash buddy helps out. And if you watch his face, I put my foot up, my balance isn't that good. We block the pain face because we don't want to see it. Rob's not showing anybody. Okay? We're gonna camp out here for about 2 minutes. How long? About 2 minutes, yeah. But we're not gonna keep you on the camera for 2 minutes. All right, come on down. So, how much you feel that? Like crazy, right?
Yeah, when you push it up.
Yeah, so when you fulcrum over that area in the back of the spine, it puts more of a stretch on this because it attaches on the inside of the humerus. Next one he's gonna do is he's gonna give this a yank. So we're gonna distract the joint itself. And he's gonna let it come out, and then he's just gonna use his scapula to retract and protract that scapula. So he's gonna retract it all the way back, and then let it protract all the way out. And when I put my hand on him here, what did I say before? It's like all crackly. It's all crackly and nasty in here. So this is gonna help free up that joint because it's stuck. So this is gonna help free up that joint and get that posterior capsule moving the way it's supposed to. So this is homework number 2. Go ahead and let go of that. Here's the fun one. Now, I'm gonna put a caveat in here. We don't wanna have this over your face, okay? So go ahead and grab this. He's gonna use this. Now you're gonna camp out in this position for about 3 minutes. So you notice he's barring out the arm. He's actually got some pretty good rotation with his arm because he can come all the way around like this. What he's letting gravity do is drive that head of the humerus into the posterior portion of that glenohumeral fossa, that shoulder capsule. The most sturdy and stable portion of the joint is in the back of that capsule. So as this is sitting like this, he's just gonna camp out and let gravity do this. I would have him hang out here for 3 minutes. It's not so bad, right? No. So he's already peeled the scapula away, and he's just letting it sit in the back of the joint. As it sits in the back of the joint, and it gets closer and closer to where it's supposed to be, it's more stable, but it's stretching out the fibers in the posterior portion of that joint as well, allowing them to move the way they're supposed to, because the shoulder has what's called this roll, slide, glide. But in order to get your arm overhead, you need to allow that shoulder to have that inferior portion to let go, to have some slack in it, so you can bring your arm all the way because the scapula rolls up like this. I know I'm keeping him here in this position, but the scapula rolls up like this, so when it rolls up, it aims that fossa, that portion of the joint up, so we can get our overhead shoulder position. If you get a pinch in the shoulder, it's because this is really stuck. Go ahead and put this down. We got one more though, he didn't know we were gonna do this. I'm gonna grab a barbell, and he's gonna watch. We're gonna come running over. We're gonna smash the long head of that bicep tendon. So Rob, you're gonna lay on your back. So he already knows what's coming. Long head of the bicep attaches to the coracoid process in here and then runs all the way down. This does what's called shoulder flexion, so it brings it all the way up. So he's gonna lay on his side just a little bit. Good, and he's gonna take his left knee and put it on the bar. And he's gonna take this, and all he's gonna do is aim his arm like this, and he's just gonna try and recover a lot of that internal rotation. It's so awful, isn't it? I mean, this is just abysmal, isn't it? He's doing his best. Remember, there's millions of people watching, so he's doing his best not to show anything. He's gonna take that right knee and crank it on there as well. Oh, that's just awful, isn't it? Hold it with your hand. So there we go. So all he's gonna do is he's gonna recover this. We're trying to get that hand all the way down, just like that. And like he said, baseball, a lot of overcompensation. I'm being a good friend. That's all I'm doing is I'm being a really good friend. Chris is laughing. Rob is like, this is so painful. But what's really crazy is when I'm done, as we peel this off the bone, get this moving the way it's supposed to, you're gonna find that shoulder doesn't pinch as much. And check this out, come on off. This is gonna be trippy. Put your arms all the way overhead, as hard as you can. Come here. Come all the way around to this side. Look at this. Look at his left shoulder. Look at his left arm compared to his right arm. You see the difference? That's nuts. This is back further than this one, which means it's sitting in a more comfortable position upright, and it's in a much more stable position. So we unglue this tissue. You can put your arms down. How does it feel?
A lot looser and better.
Yeah, see what I mean? So it takes like 5 minutes. That's gonna restore that posterior inferior roll slide glide. So get that shoulder moving. Rob, Trev, do the homework, the 4 things we just talked about. I'll see you tomorrow.